With exercise adherence, there's a lot of factors. It can be barriers, for example, cost, transportation, not having a facility locally. For example, rural patients may have a harder time. It could be related to self-efficacy, just trying something new. Definitely pain with exercise is another factor. So I think there's multiple factors involved with how do we incorporate better adherence when it comes to exercise prescription. But again, that's true whether you have chronic pain or not. I think as a society, we have to do a better job with promoting that health and wellness and really think of exercise as a vital sign. Individually tailor the exercise to your patient. Again, lots of different exercises are beneficial, so I think it's important to get a baseline. Where are they at? If people aren't exercising at all, maybe start with walking 5 minutes a day. Also ask, what does a patient like to do? For example, do they like strength training? Do they like more aerobic? What have they done in the past that they've enjoyed? Because like I mentioned, the majority of different types of exercise have been shown to be beneficial. So what do they prefer to do? Motivation techniques, so we can talk about supervision of the exercise. That's been found to be key. If you are held accountable by someone, if you're being supervised while you're exercising, you're more likely to do it. Also booster sessions, when people exercise, as soon as their pain goes away, they tend to stop, or as soon as they're discharged from physical therapy, they stop. So I think part of that is just education. So talking about how exercise can also be preventive with, say, recurrent low back pain. And then also with the booster sessions, hold people accountable. So have them check in every month or every other month. And no one wants to do the exact same exercise, so even being discharged from physical therapy, I don't expect my patients to do the exact same exercise for the next 5 years. So what I expect that they do need some progression of the exercise, or maybe some fine tuning with how they're exercising. So we want to be physically active, but we also are in a society where we like service. You know, we can pull up and have people put our groceries in our trunk, in our car trunk, right? When we get our medication filled, we can stop and get a window and have them pass through the window. So I think that is actually, it's not beneficial for the promotion of physical activity. So we have to do a bit of a mind shift. And also make it easy, make it convenient for people to exercise. I know as a professor, I can sit for 6 hours at a time, and it's really hard for me to get up and move because I focus on my work at the computer. So even taking breaks, I think insurance is problematic for a lot of people. So a huge barrier is just the cost of insurance. We know there can be problems with pain medication. For example, we're all familiar with the opioids. But I think if we want to do a shift and we want to start thinking about more non-pharmacological pain management, we have to think about how the finances are structured and how to better make it more convenient and affordable for the majority of people.